Are you alright, Dad?
Yes.
Sit down, please.
No.
Nurse?
No.
Nurse? Can you come and help me?
Hey, Ron, you need to stay in the bed.
No,
what's
spiders.
wrong? Where's the
Spiders in the bed.
No, there's no
Spiders.
spider. You need to stay in the bed.
Spiders
Ron,
in the
no,
bed.
it's too dangerous.
Is everything okay? Ron, are you alright?
Spiders.
No, he's not. I'm
Spiders in
really
the
worried
bed.
about him.
No, there's
This
no
is not
spiders.
normal for him.
How does he normally mobilise?
He's pretty independent. He walks by himself.
Then I think it's probably best that we put him in the chair.
Is that okay?
Yeah, that's fine.
Okay.
Jai Chi, do you mind coming in?
Watch out, Ron.
Careful.
There you go, Ron. So, Ron, this is Jai Chi. She's an assistant and nurse, and she's going to stay with you and keep you safe while Ben and I go out and do some more assessments. It's likely that your father-in-law has a delirium, so we'll just need to do a few more tests, but Jai Chi will stay with you in the meantime.
Oh, I'm really worried. Can you do something for him, please?
Yes, we just have to go off and have a look at his notes, but Jai Chi will stay with you.
Thank you.
Ben, do you want to come with me?
Yeah, sure. Thank you, Josh.
No worries. Hi, Ron. I'm Jachi. I'm a nurse assistant. I'm here for you. Keep you safe. How are you?
Spiders.
Oh, it's okay.
Spiders.
You are here. You're in the chair. There's no spider that can hurt you.
Chachi, what's
Yes.
going on?
I think you guys is going through the delirium, and the two nurses are going to do the first assessment for him.
I'm really worried about him. He will be fine, you think?
Yes, he will be safe because I will be here for him.
Oh, thank you.
No worries.
So, Ben, can you tell me what's been happening with Ron this morning?
Yeah, so Ron is trying to get out of bed and he tried to walk around. Yeah, so because he's high risk for being patient, so I just keep him in the bed.
And what's the reason why Ron's in hospital?
So he just had a liver resection 2 days ago and transmitted from ICU.
And his medical history?
His alcohol withdrawal and smoke withdrawal. Yeah, he used to be a heavy drinker.
And any history of cognitive impairment?
No.
So it sounds like Ron is delirious, Ben. Have you ever done a confusion assessment method before?
I am, but I'm not that confident with doing the delirium assessment.
Would you like me to go through it with you?
Yes, please.
So the CAM has 4 features.
Yeah.
Now you need features 1 and 2 and either features 3 or 4 to be positive for delirium.
Okay.
So feature 1 is an acute onset and fluctuating course.
Yep.
Would you say that Ron meets this criteria?
Yes, because since he admitted to here and from yesterday, he was fine, not like this, very agitated and very aggressive to peeling all his IV lines.
And would you say that Ron is inattentive? So is he easily distracted, having difficulty following instructions in the conversation?
Yes, he's distracted. Even I asked him about some simple questions, he cannot even focus on my question.
So he's scoring positive for features 1 and 2.
Yes.
Features 3 is disorganized thinking. So illogical flow of conversation, delusions, paranoia, hallucinations. Is he meeting this criteria?
Yes, because he said he saw spiders on his bed, which is not, I think he got some vision illusion.
So because he's positive for features 1 and 2 and features 3,
Yes.
he's actually delirious.
Oh, okay.
But feature 4 is altered level of consciousness, and I noticed that Ron's very hypervigilant in there.
Yeah.
Is that a normal level of consciousness?
No, I think he's hyper alert. I think his consciousness.
So he's scoring positive for all 4 features of the CAM.
Yep.
So now we need to determine the underlying cause of delirium,
Okay.
which is most of the time multifactorial, particularly in patients like Ron. So he could be in alcohol withdrawal, so we need to put him on an AWS.
Right.
He could be in nicotine withdrawal, so we might need to get him nicotine replacement therapy. He could have pain, surgical site infection,
Yes.
dehydration, malnutrition, and constipation.
Constipation.
So now we need to go and do a head-to-toe nursing assessment to
Okay.
determine those underlying causes. Do you feel confident with carrying on with the delirium assessment?
Yes, it's very clear for me now.